I want to end on contact investigations and then give some updates on some of the newer guidance around contact investigations. I've shared this previously, but it's worth noting again because this is information that's evolving daily. Currently, we have been able to close 64% of our contact investigations, and what that means is those are cases that are completely closed and the file is put up. We oftentimes will have a significant number of open cases, and that's because of the volume of cases that came in July, and then the ones that continue to come in August. And as of today, we have identified almost 24,000 contacts, and currently we have 9,763 people under quarantine. So just as a reminder, isolation applies to individuals who have been diagnosed with COVID, and individuals have to be isolated. That means away from everybody else for a minimum of 10 days, and they have to be symptom-free for 24 hours. That is a change that's just come into effect in the last week or so. So 10 days and 24 hours symptom-free. But if someone is symptomatic, they may have to be isolated for well over 20 days. And it's just important to note that because it does have a significant impact on one's ability to work, go to school, and so on, which is another reason we want to reduce transmission, particularly as we are more in what I have called marathon mode, and a focus on living with COVID and reducing the impact in our community. So we want to reduce the impact on people's ability to work and children's ability to go to school. For those who are contacts, and that's individuals who have been in close contact with a known case while that case was infectious, have to be quarantined for a minimum of 14 days. If it is a household contact, the 14 days does not begin until the 10th day of the case's infectious period. What that ultimately means, and this is particularly germane to students, because they may actually have been exposed in a household, that a child who is a contact could actually miss up to 24 days of school because they have been a contact. So we want to make sure we're getting back to business, we're getting back to work, we're getting back to school, and we want to continue to strive to reduce transmission in our community. So we really applaud everyone in Shelby County who has taken the steps necessary to reduce transmission. We know this has impacted businesses, it's impacted our ability to be social, and quite a significant number of areas have been impacted. But we really implore you to stay the course, continue to wear your mask, continue hand washing on a regular basis, continue to make good decisions about where you travel, when you choose to go out, what events you choose to go to, and if you have any symptoms whatsoever, get tested.